Egg freezing, the process in which a woman's eggs are extracted, frozen, and stored for later, for when she's ready to become pregnant. It's said that egg freezing initially was used to help cancer patients preserve their healthy eggs while undergoing cancer treatment. Makes sense, right? Today, women are getting married later. They're having children later. And so a lot of women are turning to egg freezing as a fertility preservation method. From Celine Dion to Kim Kardashian, and even up until recently, non-confirmed, a 50-year-old pregnant Janet Jackson. It's giving the women an opportunity to hit pause, snooze on that clicking, ticking biological clock. It leaves tons of questions, and I ain't got the answers. But that's okay, see, I always got you covered. I'm here at Trio Fertility, and I'm about to go up and speak with Dr. Sony Sierra, where she has the answers. I'm here with Dr. Sierra, fertility specialist here at Trio Fertility. Thanks for joining me, Dr. Sierra.
Thanks for having me.
Okay, so we've established, or I've established, what egg freezing actually is. Can you walk us through the procedure?
So an egg freezing procedure is actually vitrification or quick freezing of human eggs.
Okay.
And how it works is it's based on a natural menstrual cycle, but we hijack it with hormones that will stimulate production of multiple eggs in one menstrual cycle, as opposed to naturally you just get one egg per cycle. And once these eggs are stimulated, the eggs are retrieved in a procedure that's done here at Trio Fertility in a procedure or operating room.
Okay.
And then eggs are retrieved within their follicular fluid or the fluid that surrounds them, and the embryologist will sort through the fluid, pick out the mature eggs, and then they're frozen.
Okay. When you say the mature eggs, I'm curious, can you tell if a mature, like not a mature, but can you tell if an egg would be useless? Like at that point, you can tell, like, we can't use this one, it's not.
Yes.
Okay.
There's certain structures that the embryologist will look for that herald an egg that's mature.
Okay.
And it's only the mature eggs that we can then manipulate.
Okay.
And essentially they have to be injected with an antifreeze solution that'll protect the egg as we do the quick freezing. So we need to only recruit and freeze the mature eggs.
Okay. And how many eggs can one produce, or how it can be retrieved?
So ideally, when we're doing a cycle like this, we like to freeze between 12 and 20 eggs.
Okay.
Somewhere in that number is the sweet spot where we can look forward to a good chance to conceive with that egg freezing cycle.
Right.
And that's the number that's actually safe. Now, sometimes we overproduce eggs.
Okay.
It's one of the risks of egg freezing. It's called hyperstimulation.
Okay.
And 1 in 100 women, when they take these medications that will produce multiple eggs, will almost kick into overdrive and make so many eggs that their ovaries can actually become very enlarged, start to secrete extra fluid that will disturb metabolism and electrolytes, and people can get quite sick.
Wow.
So it's one of the only risks actually of egg freezing, medical risks related to the procedure. But yeah, so we don't like to retrieve too many because that means that the patient's at risk or the woman's at risk for hyperstimulation.
Okay.
So somewhere between 12 and 20.
Okay, that's a good amount, I'd say. My other question is the procedure painful?
The procedure isn't pain-free.
Okay.
But when an ovary is stimulated, it actually hangs low. It's almost like grapes on a vine.
Okay.
So we use an internal ultrasound probe, and using the internal ultrasound probe, we can position the ovary so it's right next to the tip of the probe.
Okay.
And then we use a needle to insert through the vaginal mucosa into the ovary.
Okay.
So it's not that it's a needle that's getting poked around your pelvis. It's very guided under ultrasound vision.
Okay.
And so you can feel a little pinch when the procedure is being done, and sometimes you can feel pressure from the ultrasound. But we give medications.
Okay.
So there's a little bit of local freezing that goes in, and then also we give what we call conscious sedation.
Okay.
So people are comfortable and usually don't remember much of the procedure.
Okay. Yeah, I'd need the drugs.
You need the drugs.
Yeah. My other, I was wondering, well, I did a bit of reading on it, but it seems like the average age, or a good age, I guess maybe not a good age, but a cutoff age is about 37. Why is that?
So women have reproductive limits, so it's just the way we were born. It's one of the hard biological facts about being a woman. So we have an ideal age that we should be reproducing that's going to give us the highest chances to conceive, and that's somewhere between 15 and 35.
Mm-hmm.
So when we're trying to conceive within those age range, we have a good chance, and a good chance is about a 20% chance per month on a natural cycle to achieve a pregnancy.
Okay.
And if for some reason you have to use the IVF lab and you need assisted reproduction, during those age ranges, you'll find the highest rate of success. Now, having said that, we don't do IVF on 15-year-olds, etc.
Right.
So usually, in your 20s, early 30s is when you're going to have the highest chance of success.
Okay.
Egg freezing is a procedure that's come into use as of 2012 when our technology allowed us to do egg freezing. But from the data that we have collected so far, it seems very similar to that ideal age for when we do IVF.
Okay.
So when you do egg freezing, it's not a miracle cure that's going to guarantee your fertility 100%.
Okay.
It's going to give you a similar chance to conceive as if you had done IVF at the age at which you have the egg freezing procedure done.
Okay.
So in other words, you're going to have the highest chance of success, less than 35. And most IVF labs have a good pregnancy rate up until the age of 38. It's not like at 35 your fertility falls off a cliff. There's
Right.
a gradual decline.
Okay.
And so we tend not to do egg freezing procedures in our lab beyond age 38.
Okay.
But again, as we learn more and as more women start to thaw their eggs and use them, we'll be able to readdress what our pregnancy rate success and perhaps change that age guideline.
Okay. You mentioned thawing of the eggs. So initially when I heard about the procedure, I was like, I wonder if it's kind of like when you have food and then you put it in the fridge and you freeze it, and it's not as fresh as when, you first, if you cook it fresh. Right off the rack, or however you want to put it. So my curiosity was, does the egg, I guess, lose a little bit of integrity because it was frozen, or is it pretty much the same as...
It actually, I think it depends on the quality of the egg.
Okay.
So if you have a good, mature egg that's actually genetically normal, because the genetics of an egg are determined before it is actually retrieved.
Okay.
So if you have a good quality egg, it will likely survive the freezing and the thaw. But again, it's not 100%, and that sort of speaks to the fact that there might be something in thawing the eggs that decreases their chance of success.
Okay.
Yeah, but it's indefinite.
Okay.
Yeah.
What does that percentage maybe look like? So I find that the way I've seen egg freezing positioned is as and maybe it's because it's fairly new, but it's been positioned almost as our golden ticket.
Right.
And I think it's a little misleading because I think people don't take in the fact that this is not bulletproof. This is not 100%. So what does the percentage really look like?
So the percentage looks similar to what IVF success rates are,
Okay.
which are nowhere near 100%.
Okay.
I think one day they will be. I think we'll get there eventually, but now, no. I think in the ideal age group, less than 35, they're about 50 to 60% chance of success. So if you were to freeze your eggs less than age 35, when you go to thaw them, fertilize them, and use them, you're probably at a 50-60% chance of success.
Okay.
If you're over 35, between 35 and 37, it's going to be a little bit lower, 40 to 50% maybe. And again, it depends on the egg quality. And at that point, it will also depend on male factor and just the embryo integrity.
Okay. So my next question, leading with age, is very recently we all found out that Janet Jackson is expecting. She's 50. Woohoo, Janet! And no, this is not to say, because I've heard, I've tried to look it up, and it's not confirmed whether she froze her eggs or not. But a lot of women are having children a little later in life.
Right.
So, what are some risks with later pregnancies, or when in terms of egg freezing? I think to myself, I'm freezing my eggs. I have until, what's my cutoff?
Right, to use them.
Right.
Again, there's no definitive cutoff.
Okay.
The uterus, where the embryo will be transferred and grow a pregnancy, is an amazing organ. It doesn't age. It's like
Okay.
a little incubator. You can make it do what you want to do,
Okay.
and it doesn't age. And that's why we hear there was a case in Calgary of a 63-year-old who
Right.
gave birth. There's cases that happen internationally all the time. So the uterus doesn't age. But Janet Jackson, she might have frozen her eggs or
Right.
frozen embryos. But at 50, having a child, there are risk factors. If the embryo is young and if the egg is young, we avoid the risk factors of having miscarriage, an increased risk of miscarriage, or an increased chance of having a baby with a genetic issue.
Right.
But there's obstetrical risk to the mother. So as we get older, we have a higher chance of having an operative delivery, in other words, a cesarean section.
Okay.
That's a major surgical procedure with risks. There's also risks of developing hypertension, blood pressure issues during pregnancy, and there's also the risk of developing diabetes in some women in pregnancy, and it could just be a harder time in terms of carrying and delivering a baby.
Right.
The other thing that we have to think about that some people don't is it's hard to take care of a baby as we get older,
Yeah.
right? It involves sleepless nights. You have a toddler,
Yeah.
you know what it's like, the energy requirements. So I think, we will do, for instance, egg donor cycles up until the age of natural menopause, which is just before or at 50.
Okay.
But the reality is when I counsel patients, I always get them to also think about these social things. How much energy do they think they're going to need, and when is it going to wear off?
Yeah.
And, in terms of planning the long run.
For the long term, right?
Mhm.
And I love that you mentioned the counseling, because
Mhm.
when I see like celebrities who have kids later in life,
Right.
I'm like, okay, but it's not just seeing them having kids later in life, but it's also seeing people like, hey, yeah, me too, I'm gonna,
Yeah.
and I'm like, well, that's their reality, because
Mhm.
behind the scenes, you don't know, maybe they have tons of energy, maybe they have
Tons of
nannies,
help.
right?
Yeah.
And then you mentioned I have a toddler, like, I have the 3-year-old, and I
Yeah.
feel like sometimes like he's 10 people,
Yeah.
and I'm exhausted. So I can't imagine having him, maybe having had him like 20 years later.
It's harder.
That's a personal thing. So I think it's something that people really need to consider, and I like that you guys incorporate the counseling
Yeah,
to
I
make
think it's important.
Yeah.
And I think for that reason, there's been a big, it's out there in the media about egg freezing, and it's forcing women to think and have these conversations. And for that reason, I think it's good that people like you are interested in talking about it and starting a conversation, because there's a lot to consider.
Yeah.
Of course, it's the biology. Of course, it's sort of empowering women to make these decisions.
Mhm.
But then we also have to think about, okay, how long should we delay, and
Right.
when is the right time, and taking it on as a single woman later if Mr. Right doesn't show up, or
Right.
you don't find the right partner. So there's a lot of things to consider, but I think starting the conversation is the best to start.
Yeah. Okay. So I was also curious about the duration of these eggs. How long can they remain frozen?
So they can remain frozen indefinitely.
Okay.
Because of the freezing technique that they use, and the cryoprotectant, and the vitrification is the name of the fast freezing technique.
Okay.
And so far, I think clinics are probably busy collecting eggs and freezing them. We haven't had a lot of people thaw them and actually use them.
Okay.
But if they're like embryos, it's an indefinite period that they're going to be able to, be able to withstand the freezing for.
Okay. So you mentioned embryo, and I'm glad you do, because I initially I thought egg freezing and embryo freezing were the same thing.
Mhm.
Can you clarify that for us? What's
Yes.
the difference between the two?
So egg freezing is the freezing of mature oocyte.
Okay.
So from the female only, freezing the single egg cell.
Okay.
Embryo freezing is actually freezing of a fertilized egg
Okay.
with the sperm of the woman's choice, whether it's a partner or husband.
Okay.
And then the embryo is cultured and grown until it usually reaches a phase called blastocyst.
Okay.
And then it's frozen at that phase.
Okay.
The technique for freezing is very similar, but the pregnancy rates, or the ability to reproduce with frozen blastocysts or embryos, is a little bit higher than
Okay.
eggs, because they've been tried and tested a little bit
Okay.
in terms of being fertilized and cultured and making it to that blastocyst stage.
Okay. Interesting. I remember reading about Chrissy Teigen getting a lot of backlash because she, well, I guess it's a little different, but she went through the process of freezing eggs and also freezing embryos. And she selected the gender of her baby.
Okay.
Now baby Luna, shout out to baby Luna. So she got a lot of backlash because she was like, you know,
She wanted a girl.
she wanted a girl, and people didn't like that. And you know, she was like, it's my choice. They're my embryos. I have the option. I feel like this is giving women a lot of empowerment, a lot of more control. Not necessarily the choosing of the gender, but just being able to freeze your eggs. I mentioned before, it's like hitting snooze on the biological clock, almost. Have you found that there's an increase of women coming in and wanting to be informed about this procedure?
Yeah, I think across the board, all assisted reproductive therapies make the general media when celebrities use procedures like IVF or embryo freezing or egg freezing, and it generates interest. And also big corporate organizations like I think Yahoo and Google are offering to pay for egg freezing for their young female employees. Again, empowering them to devote their 20s and early 30s to achieving what they want to in terms of education and work status. So these things that are in the media are increasing interest. And also I think that our technology, the advancements we've made in technology with egg freezing, is also allowing women to make informed decisions about when and how they want to raise a child. And I was just reading an interesting stat recently that came from the CDC in the US that stated in a 5-year period from 2007 to 2012, the incidence of women, single women over age 40 having a child on their own has gone up by almost 30%.
Wow.
So we see it in the clinic. We see a huge number of women around 40 coming in, usually for fertility assessment to explore their options.
Right.
At that age, egg donor isn't really an option, or sorry, egg freezing isn't an option unless they froze previously.
Right.
But we can look at other assisted techniques to help.
Okay, that's great. Dr. Sierra, thank you so much for your time.
Thank you.
I was informed, I hope you all were too. If you are in the Toronto area and you're interested in egg freezing or any other type of fertility procedure, I will have the information of the Trio Fertility in the description box below. Make sure to check them out. And I'm curious on your take on egg freezing or any of these procedures, maybe embryo freezing. I mentioned Chrissy Teigen getting a lot of backlash, not necessarily for freezing her embryos, but you know, it's definitely just a conversation that can be controversial. So I want to hear what you think. Would you freeze your eggs? Do you think it's too much? Leave your comments below, and I'll see you in my next video. Until then, rise and reign.